There we go. So again, thank you all for coming. We really appreciate it. I'm sure we'll have some more folks that will join. I'm here at the Equality Community Center with the wonderful Nikki Williams, who's doing some work on oral health. And then we have all of you. And so the way the day is going to go, I'm going to show you a welcome video from last year. I'm sorry it's not updated. Just to kind of welcome us. And then I'm going to turn it over to our facilitator. So let me show, oh, and I also, one more thing before we go. I was talking about it this morning is, for some reason, I'm not sure why it's taken me 3 years to figure this out. But for some reason, I realized that we do this the very, very last week of February. We end Black History Month, and then we go into Women's History Month. And so it's just the perfect week for us to do this. I just want to say happy Women's Month to all of those fabulous women out there. So let me let some folks in. People are still coming in. And then I'll share my screen and then I'll turn it over.
Bienvenidos. Marhaban bikum.
Karibuni.
Yokoso. እንኳን ደህና መጣችሁ። Boye Bolam.
Soda weather.
Bienvenue. Bem-vindos e bem-vindas. Baganagayan Luftan. Agwane.
Welcome to the second annual Black History Month Community Wellness Fair. We are so excited to be able to bring you such a variety of topics and conversations and panels that have to do with health, health disparities, and a whole host of other things. We have so much planned for you this week. We're so excited to bring it to you. I first want to thank all of the folks in the planning committee and all of the folks that had a hand in putting together this welcome video. It's always good for us in Maine to see the amazing diversity we have across the state and how we're able to bring you that language diversity so that everybody who attends this fair this week will be able to hear and see a little bit of themselves in everything that we're doing, including our welcome. Again, we're so excited that you're here, and we hope that you enjoy what we have. There we go. And so I am gonna, hold on, let me just, I don't want another video to spark up. I'm going to turn it over to our facilitator. Welcome.
Hey everyone. My name is Olion. Can you guys hear me? Okay. And I'll be the facilitator for this event. First, I would like to welcome you all that you are here, that you took your time. I know it's really busy out there with work, but thank you for being here. A little bit about myself is that, again, my name is Oliona Gatako. I'm a PO Post Navigator at Gateway Community Services, Maine. And I've been with the company for some few months right now. I would also like to maybe introduce, or maybe I would let you guys introduce yourselves, the panelists of today. Please go ahead and introduce yourself. We can, okay.
Okay, thank you. Hello, everyone. My name is Catalina Piedrahita. I work with the Maine Department of Labor, and I oversee the Healthcare Workforce Initiative. We have two offers under this initiative. One is the tuition remission program that is intended to pay for healthcare professions, to pay for tuition for healthcare workers and for employers that are interested in upskill their employees. And the second offer is the healthcare navigators. They are housed at the career centers, and they are career center consultants specialized in healthcare. So providing services to job seekers interested in employment or training in healthcare. So thank you for having me here.
Thank you so much, Katarina. We can go ahead to the next panelist, Nicole Breton. I'm so sorry if I mispronounce your name.
Hi, everyone. My name is Nicole Breton. I am the State Director for the Maine Center for Disease Control for the Offices of Rural Health, Primary Care, and Oral Health. Thank you for having me today.
Thank you for being here. Would you please introduce yourself, Sarah Lewis?
Yes. Thanks for having us. I'm Sarah Lewis, a director at Maine Access Immigrant Network. I would be joined by my colleague Sanat Abdul-Jabbar, but she had a health emergency, so she's unable to be here, but I have her comments to share. And Maine Access Immigrant Network is a nonprofit community-based community health worker program based out of Portland, Maine.
I think we can go with Brian Foley.
Well, hello. Nice to be here. Thank you, everyone, for having me and engaging in this conversation. I'm Ryan Polly. I'm the Vice President for Diversity, Equity, Inclusion for Maine Health at the system level. So my role is really in we've created a 5-year strategic plan for DEI, and now my role is helping move that plan forward throughout all of our hospitals within the system.
Thank you, Ryan. I think the last person will be Kathy on our panelists.
Good afternoon. I'm Kathy Carring Del Rio. I use she, her pronouns. I'm the Advocacy and Programs Director with Maine Equal Justice. And I think we come to this conversation with a lot of experience trying to make sure people have access, low-income people in particular, have access to healthcare, do a lot of advocacy around Maine Care, but also we do a lot of work around programs that help support people with education and training to get them into the workforce if that's their goal. And so kind of see it from a couple different perspectives. Thanks for having us.
Thank you for being here. Before we can maybe start asking questions and all those kind of things, I think I would like to mention a little bit about Black History Month or what it means for me. I know for sure we all know that the month of February, that's when we have Black History Month, when we commemorate African American history and achievements and all those kind of things. But for me, it's also about the future of African American people here. It is about how far we are getting, or how equipped we are, education-wise, health-wise, intellectual-wise, how African American people are now more aware of how to make it out there. I will go ahead and maybe ask some few questions, and please, everybody, feel free to join me in this question asking time. So to our panelists. Do you know how many BIPOC members are going to the healthcare field? Anyone can answer this.
I can just jump in from a healthcare perspective. What I would say is there's a whole opportunity to increase the pool among BIPOC folks within the healthcare arena. So I don't have a hard statistic. It's not actually something that's easily measured. We know nationally the healthcare industry is one of the fastest growing sectors in the country, and we know disproportionately the healthcare industry is still predominantly white. And so we need to recruit more BIPOC individuals for so many reasons, which I'm sure we'll talk about today. Percentage wise, I can't give you a hard stat, but I can tell you that it's disproportionately still leaning quite heavily towards white applicants.
I'll agree with you 100%, Ryan. And, you know, I'm very curious about why do you think folks, you know, African-American people do not join the healthcare system? Do you think there's any particular reasons why that is? Are they, I don't know, why would that be?
This is Nicole. So some of the reasons I think is they may not have been provided with any outreach, education, you know, while they're in school, is looked over. And so that is a very much a missed opportunity right there. The other thing is say they really would like to go on and, you know, work to become a nurse, a physician, a dentist, dental hygienist. There is a significant financial cost to that. And so we just had this whole conversation when we're working with a group of students. And really, I think schools try to do as much outreach, but not sharing what resources could be available for them to be able to move forward and pay for school. And so as an office that oversees lots of loan repayment programs, and we see what they have for student loans, it could be 200 to over 600 plus thousand of loan repayment they have to pay. And so that may be something that deters them from having such a heavy burden of finances of going into the healthcare field. But there's programs out there that would help support them in loan repayment that maybe they're not aware of. So that's what our program has been really doing, is some outreach in that field.
Yes, Kathy.
Yeah, two things came to mind for me in addition to what has already been said is, you know, there's other barriers too that get in the way of being able to take on debt to go to school. Things like, you know, whether your family's financial situation, which we know there are great disparities in terms of wealth based on race. So that can have a real impact. And then also around consumer rights, like there's a lot of, you know, there's a lot of times where we hear at Maine Equal Justice from people who are like maybe they're trying to go back to school. They went to school already, but they can't actually access their transcripts from wherever they already had classes because they still have debt at that school, but they can't get out of that debt because they don't have the job to get out of that debt, or there's some other problem that's getting in their way. And so programs that can help people with those like relatively small cost things in the grand scheme of education, higher education especially, that can then, but can really move mountains for someone to actually move ahead with their education, I think is really important. And then one other piece I did just want to name too is that we also have folks, you know, when you look at particularly certain fields in medicine, there's less diversity, which then means people have fewer people in their lives that are already in that work, right? But then we also have some folks who are newer to our country who maybe are coming with that background, but they can't actually use their training or education when they get here because of the way licensing works. And so like trying to remove barriers for people who are newly in our state from another country so that they can use the credentialing that they have somewhere else, or make the process shorter for them to be able to engage in a meaningful way in health professions, I think is important. And then also trying to expose younger people who are Black or Brown in our schools and colleges and other programs to those who look like them, who are in those roles already, can really demystify it. We hear that a lot at Maine Equal Justice.
Thank you so much, Kathy. I think we can hear about Ryan.
Yeah, I would just, I mean, I'm going to agree with what's been shared. And I think the other thing that's sparking for me is there's also disproportionate, really racialized segregation within the industry. And what I mean is that, you know, if you really take, and across the country, if you take healthcare and you look at the various roles, where you're going to see BIPOC folks disproportionately is in the most entry-level positions. And then you see people getting paid the least, and you see them really stuck in these roles. And to Kathy's point, people could be coming in with advanced degrees, the background in medicine if they're coming from other countries, and they get stuck. Or people might enter because they're interested in healthcare. Maybe they're like, I want to be a tech or a nurse or a doctor. So enter through these gates, but because of the systemic issues within healthcare, people get stuck in those disproportionate, in those positions that allow for that disproportion. So I think that in addition to everything we're describing, the other side of this is that inside the walls of healthcare, there needs to be career laddering and mentorship programs within the institution itself so that folks have an opportunity to build their resumes, build their skills, get connected with leaders within the system that will bring them along. We still see, last I looked at 2019, 89% of hospital CEOs were white. And so as you get higher into the system in terms of level, right, you see way, way more homogeny. That's a lot of the, you know, systemic barriers that it requires everything we're talking about in order to not just recruit, but retain and develop BIPOC individuals in the industry.
Thank you very much, everyone. I mean, I heard what, all of you said about financial situations, consumer rights, not being able to access something as small as transcripts from previous universities or colleges, issues with people who are new immigrants to the United States, barriers from, not having people who look like them, or how representation matters. And most importantly, I would agree with Ryan when he mentioned about racial segregation. I think this is a subject that most people do not, sometimes don't want to talk about. But if I may ask another question specifically to Ryan or any other person here, panelists, or all the people who are attending this meeting, do you believe, or would you agree that systematic racism explain why BIPOC aren't entering this field, the field of, healthcare? Do you think that is the main reason why things are the way they are right now?
I don't want to take all the airtime. I'll just say yes. I think that systemic racism it's so steeped in the United States country and how things have been beyond the United States, but the United States is my lens, right? It's very steeped in this country. It's very steeped in the field of medicine. And we could go into that. That's not this panel's discussion, but really, if you don't know that, understanding how medicine was created and how this field got to where it is, it's all based on systemic racism. And so I think that it is 100% a reason why we are where we are today. And that's why I think it's going to require all of us to work together to figure out how to overcome that, because it's so deeply entrenched. And now I'm going to stop talking for a while to give other folks a chance to jump in.
I think I'll jump in here. Can you hear me? Okay, my video feed is very slow. Is it okay?
We can hear you. I can hear you.
You can hear me. Okay. Yeah, Ryan, I mean, I would agree. I'll talk later about our program. It's a pipeline program that reaches out specifically to the communities that are from students, high school students who are from immigrant families from all over the world. But consistently, we keep rubbing up against this issue, which Ryan, you just highlighted. And I think it's interesting that you say, and I understand why, this is a topic for another discussion, which is the birth of medicine in America and its history and its white patriarchal structure, in that it is not meant to include certain populations, neither in its design or in its delivery. If it were, we wouldn't be sitting here in 2023 flustered over trying to click off the tick marks for how many people we have in our workforce from certain populations. Are we well the populations that they're serving? If we really cared, we'd put our money there, and we would follow through with making sure that people are funded to go to school. In other countries, people go to medical school for free. The government pays for them to go. It's amazing that in a first world country here, we still require people to take such a financial risk that it's really a risk for a lot of people who don't come from a place of privilege at all. And when I say privilege, I don't mean even generational wealth. I mean a home to go to when you can't pay your rent because you're not paid enough during residency. It's amazing that we don't have that kind of widespread subsidy to get certain people to get more populations into the field of medicine, into the field of dental care. So I think it is really relevant what you brought up, Ryan, that we can't really address this issue until we look at how this health system was designed. Because otherwise we are kind of trying to encourage populations, BIPOC, LGBTQIA, women, low income, pretty much disenfranchised groups from encouraging them to join into institutions here in the US that really haven't shown a lot of, demonstrated a lot of desire to have people from those groups lead, not just be a part of the team, but actually take leadership of hospitals, take leadership of healthcare hospital designs. And it's something that has come up in our discussions with high school students, and a lot of the professionals that we bring in, healthcare professionals we bring in our programming to talk to high school students. New Mainer Public Health Initiative, Maine AHEC, University of New England, and Maine Access Immigrant Network have a program that's happened since 2017. It's a pipeline program, and it includes high schools from the Androscoggin County area and the Cumberland County area. And we work to get high school students who are from immigrant families who have expressed an interest in a health career, exposure, paid internships, opportunities to shadow, mentoring, college prep, like how to fill out a FAFSA. And if you don't understand how to, we're going to get you connected to someone who does. Trying our best to eliminate the gatekeeper barriers that a lot of people from disenfranchised groups experience when you're trying to enter into this this profession that you do have to know someone in a lot of ways and have the right mentorship or path or support group helping you at every step of the way in high school, then in college, then with your MCATs and beyond through residency. So it's a lot of words to say. Ryan, I'm really glad you brought it up, because I think the very origins of our system are the problem as to why we're struggling today with getting people excited to be a part of a system that hasn't really expressed a desire to have them lead. And if they did, we'd see money on the table for more people to go into these professions.
Thank you so much, Sarah. I think you really mentioned a lot of good points. And, I have some few questions following up what you said. Something stick with me. You said, the health system was designed to not include, BIPOC members. And I'm wondering, can we change it? How can we eradicate that? How can we work towards making it better? And I know you mentioned, things about your program, college prep, paid internship, which is great, but I'm just wondering, does the program provide funds or scholarships to those high school students who are like interested in becoming doctors or nurses or physicians? How exactly does the program help them to achieve that, in addition to what you mentioned?
If it's okay, I'll answer first, and I'd love to get other panelists' perspectives.
Sure.
With a couple of medical students, one from UCLA who's worked with us in our program, and one from Tufts to prepare for this, just to get their wanted to and thus and college and then medical school. And one of them from UCLA said that she specifically looked at the UCLA program because they have this program called UCLA Prime. And she said, I wish there were more programs. I wish almost every medical school had these programs because it focuses on medical leadership. So leadership, like just what you said, how do we get more people into these leadership positions and interested, and then how do you send them on that way and support them until they get there? And when they're there, support them, because they're still working to make such great changes in a system, again, that is doesn't have their history built into it, woven into it. So UCLA Prime, she said, it's not perfect, but it is a program she's a part of, and it's students who apply to medical school get into this leadership kind of cohort. It's really a cohort for medical school. Ways to get more people from disadvantaged communities into leadership positions, to lift the voices and the needs and help those voices that are lifted meet services of the communities from which they originate, from the communities that they want to serve. She said that's one example. That's a program once you are in medical school. One thing that they also emphasized are these pipeline programs and that start in high school, but they've given us advice. Again, we started ours, this group back in 2017. We've had over 240 kids go through the program thus far from immigrant families. They said, if you can continue that support into college, that'd be really cool, because people, you get all this support, but really these are all personal connections. These are personal relationships, people you trust. And so if we can have those relationships continue on into college, where, you're starting from scratch or starting from zero. And if you're starting from a place where, let's just say your family doesn't have a history of college here in the US, you're starting from like double zero. So people need that extra support, that continuation of support going into college, helping people get connected to the right connections. So they're taking the right classes, they're ticking off the right boxes, because again, we're getting people through a pipeline into a system that at the other end of this river, we haven't fixed it yet. So we want to get them there so that they can be a part of helping us fix this problem. But they're going to need some serious support from all of us, and I would say us, meaning who are anyone who's in a privileged position, a position where they have a connection, where they know what the next step is. They said that one of the biggest hurdles, other than cost, their number one hurdle was, it is just ridiculously expensive risk, the financial risk we're taking is unheard of. And we've got, on one hand, society in America complaining that we don't have enough people represented from diverse populations in our medical system, and that we don't have enough primary care doctors. And then on the other hand, we're putting people into debt that they're never going to get out of. But they really emphasize the other than cost, this continuity of support, and that pipeline, once it starts in high school, don't let go. Keep that support going through each stage.
Thank you so much, Sarah. I think that was very, very helpful. And I definitely think that each one of us have learned something from your project, and perhaps we can even connect later on and connect you to some people who might benefit from the project. Kathy?
Well, I just wanted to add one thing that's not specific to workforce, but is about the way that our system was created in a racist way, fundamentally. I mean, we still have people, for example, in main care who are excluded just because of their immigration status. And that was definitely out of complete racist conversations that happened in Congress in the 90s, and out of complete racist intentions of the previous administration in the 2000s here in Maine. But we can't fix it because there's a lack of will to be strongly in support of recognizing that immigrants are just as much a part of our communities as anyone else. But not only that, right? Even for people who have access to healthcare, we know how horribly our healthcare system treats Black people, and how disparate the outcomes are for Black people in our country, for Indigenous people, for Brown people in our country. And the state, for example, the states that haven't expanded Medicaid yet, thankfully Maine has, but we know that the reason that that's happening in those states is racism, because white people don't want people who are Black and brown to get access to healthcare, and they're literally dying of their whiteness. And many of you, I'm sure, are probably familiar with that book, but it's such a true part of our healthcare system. And so we create this system that was never meant to support people of color. And many times people's experiences with that in that system are traumatic, are unpleasant. And so it's not surprising that people aren't like, oh my, I really want to insert myself into this system that has only ever caused me harm. And so I just feel like it's important to name that. And it's worse in certain type parts of the medical profession than others, but it's pervasive across the whole thing. And so I just feel like when we think about this, if we're not willing to also address all the other parts of the system that are racist, we're not ever going to totally solve the workforce challenge either.
Thank you so much, Kathy. Caroline here said in the chat that what is really great is that we're seeing community-based efforts to increase diversity within healthcare. For nurse anesthesia, for example, we are seeing organizations focusing on mentorship plus funding. While that is great, it's not enough. She mentioned again that we can address those of privilege, demanding seats at the table space for BIPOC people without being perceived as the white savior. I'm not sure. Okay, this was the question, I think. Can we address those privilege demanding seats at the table without being perceived as a white savior? I think I'll turn this question to everyone here at this meeting, and maybe they'll let us know what they think. How can people address or demand those seats without being perceived as a white savior? That was a question from Caroline. Well, I will put my 2 cents of what I think about this question. I think that as long as someone do some things, as long as someone is advocating for a cause they believe in, as long as it's done with good faith, whatever other people are perceiving it shouldn't matter. Whatever people are saying or how they're believing that the reason behind it. I don't think that should matter. I think what should matter is just having good faith or just having a good reason to advocate for a cause. So I'm not sure if that kind of like gives an idea of what I would think about it, but I hope that helps.
Can you repeat the question? Sorry.
Yeah, sure. I think the question is in the chat and it says, how can we address those of privilege demanding seats? I'm trying to kind of like paraphrase this question, but how can we address those of privilege demanding seats at the table space for BIPOC people without being perceived as a white savior? So I guess it's how can people demand those seats without being perceived as a white savior? Yes, and that was the question from Caroline. Yeah. If anybody else has an idea of how to maybe.
Go ahead. No, go ahead. Nolita has it. Go ahead, Nolita.
This is Nelly Gaber, for the city of Portland. I think if I understand correctly, the question is that we need representation in order, like we apply this in my program, and nowadays everybody applies everywhere, which is so good that you cannot you cannot tell people what is good for them. You have to ask them what is good for you. What do you think that's good for you? So if we have a table, if I understand correctly the question, because I still kind of not sure if I got it. I think if white people are sitting there domaining, the table and bringing their perspective rather than having us, and including myself too, so Latina, asking me what do I think, is good for me? What is the shoes in my community? Having Regina, what is the shoes in your community, right? So, and we can empower ourselves to be part of these conversations, to make sure if we cannot go, we get someone else from that particular community to be part of the table, have a voice there, and raise the concerns from the community. I never pointed like, oh, I represent the Latino community, because we cannot generalize, but at least I know more than some other people who cannot or have access at least to this table that other people don't have it, right? So yes, we have opportunities. We have, in a way, we have power, because the work that we do allows us to have these opportunities to access, to bring these concerns. So that's power. We have power, and it's our responsibility to use that power in a positive and productive way, because we have to let these people, whoever is making the decision, that there is poverty, there is injustice, there is so many things going on that we need to address collectively, because they can solve their own issues, but they won't solve the society issues if they don't have us in the table. I don't know if I got that.
I think you did good. I really wanted to. I wanted to kind of piggyback on what Nolita said. And so I think if I understand the question, it is how can white people have a seat at the table, or how can they kind of help us solve this issue without looking as a white savior? That's how I understood the question. And so I think that I agree with Nolita that we all need to be around the table. For me, white people, you got to do your homework, right? I'm more than willing to be your ally. You can ask me whatever question you want, but if we're going to invite you to the table, I'm not going to see you as a white savior if you've done your work. So there's more education that needs to be done. There's more knowledge that you have to get in order to come to the table and not look like a white savior. And so again, I think we need to do more on what a white ally is for folks in our community, so that we can understand that white people who are coming to the table are not being white saviors, but they are there to help, because
it's like Melita said, I can't solve racism. I can't solve systemic racism by myself. I have to have my white allies to do that. And so I think it's a great question. And I think it's one that I also, and I'm just going to put it out there. I do think that Black people at some point in time, we need to lower our guard just a little, because we do have well-intended white people that actually want to help us solve this issue. And so I think it's those three kind of things. So I know Ryan has something to say. And then after that, I would love to hear from Carolina, because I know that she's also working right in this field, and she's working with navigators who are out in the community. So love to hear from Ryan and then Carolina.
Oh, I'm happy to lend the microphone to Catalina first.
Thanks. So yeah, I'm kind of right now in an spectator place, hearing all of your positions, and obviously I agree with all of them. I know that there are opportunities right now, like the program I'm working with now, and I also am aware that maybe it's not enough. In our case, we have been working, so our navigators, the healthcare navigators, we have been working with all kinds of different people, including immigrants with a healthcare background, just helping them to navigate how is the licensing process. So what are the opportunities out here in Maine to start a career in healthcare? So that being said, like that position of a white savior or not, I think what is important for us is that the community knows what opportunities they have, what programs we have in the state, because this is not the only program that is focused on healthcare. This is just part of it. And that is why it's important for us to communicate with our community partners, for letting them know what is out here, how can you access our funds, because there are a lot of funds right now. Some of them have like higher barriers to access to them, but at the same time, I would like to take the opportunity to offer what we have. We have the healthcare initiative, we have the navigators, so you can refer people interested in healthcare, low income, BIPOC people, immigrants, whoever you want. And we are working with all of them, helping them to just have a training plan if you want to enter the healthcare field, or if you already have experience and you want to come back to healthcare. And if our program is not the best fit, then we are also working with these other programs that within the Department of Labor and within the Department of Health and Human Services, and some other like partners in the field. I would say that right now the offer, and I repeat, I know it's not enough, and maybe they have like a higher barrier to access, but we have the the healthcare initiative with the Maine Department of Labor. We have the apprenticeship and pre-apprenticeship programs also within the Department of Labor. We also have another program that is called Competitive Skills Scholarship Program. That is, it's focused on people with low income. Within the Department of Health and Human Services, we have the option also to refer people, for example, people with children and low income. They can access the HOPE program. They cover tuition, and they cover other additional supports like transportation, childcare, if you need help with equipment, uniforms, things like that. We also have the option to refer people to a SNAP ENT for people that is already receiving SNAP benefits. They have the option to go to this program and get employment and training assessment. So just trying to not classify these as this is right or wrong, but it's just what we have right now. I encourage people to refer people to us and if you want to know more, we are always open to have a call, to have a conversation, to explain to you, this is what we are doing, this is what we can do with you and with your case. We have been working with Oleone and the Peer Workforce Navigators. They are kind of one of our partners in this effort. We have been working with other agencies like the New Mainers Resource Center with the University of Southern Maine. So I think it's important to know what resources we have, and even if you think you don't qualify, just ask, and we will be here, and we will be very happy to help. That's it. I think.
Ryan, I think you were next.
I was reflecting on this question, this question on white saviorism, and I one of the things that I think about is that this concept of white saviorism is or let me rephrase, a white savior, someone acting in that way, is also a byproduct of systemic racism, right? So we're all part of this system that has created favors some groups and oppresses others. We're all part of that. And I think that with this concept of white saviorism, if I'm reading the question, the way I was interpreting it was the person was saying, how can you advocate for space for BIPOC folks at the table without being perceived as a white savior? And I guess if I'm reading that correctly, my thought would be anyone who, if you're white, and I can only speak from that lens, if you are questioning whether you're acting like a white savior, you're probably not acting like a white savior. It doesn't mean you're not, but oftentimes that saviorism perspective is coming from a blind spot, a bias that if you're not doing the work, you can show up as. So if there's a worry about how you're being perceived by other people, I always say, like, that's the system. Right? So if you're advocating for someone to have a seat at the table and you're being perceived as a savior, you're probably being perceived by people who are wanting to keep the system in play, keep the system going the way it is, keep the racism there. So, we have to be okay being perceived as all sorts of things in order to just break down the system and dismantle the system. And we all have to do work to be able to constantly challenge our own lenses, because our own lenses were acculturated in these systems of oppression. So whether you've been advantaged by the system, we have the privilege. So if we're talking about race, the privilege of whiteness or not, right? We're all part of the same cycle. And so if you have the privilege, we have to recognize constantly, am I showing up as a white savior? Am I taking too much space? That sort of thing. Am I not listening to the point that was just made? How can I leverage this privilege to give the space to be able to listen? And we have to also constantly be challenging all of our thinking, because we're all it's hard to think outside of the system, right? It's really hard. And I think that's why diversity is so important, because when we have a diverse table, like think of diversity in the most broadest sense and all sorts of differences around that table, if we can create space to listen among that table, we can figure out how to change this system. But it's only when we're all at the table and then we are open and listening to make those changes, will we actually change it.
Thank you so much, Ryan. I'll go to Tamara, and yeah.
Hi, I just wanted to sort of add on to that in that, like, I think coming from a place of thinking that trying to bring other people to the table is doing someone a favor, you know, like taking that, it's pretty clear when someone's doing it out of tokenism and when someone's doing it because they understand that diversity is necessary for that table to actually be efficient. Coming from a strictly practical standpoint, like racism hurts everybody. It's not an issue of like, oh, it's the other's problem. This is my problem as a white person just as much as anybody else's. And like, you can sense that from someone. And it goes back to what Regina said about like, we need to do the work to understanding how we are perceiving racism actually acting out at these tables. Like it's something that impacts all of us. And it also requires white people to be doing the work in our own communities, our own families, in addition, rather than just saying, doing these performative actions of bringing people to the table. It's so much more than that. And like, that's, I don't know, you usually just can tell pretty quickly what someone's intentions are based on how they think about diversity and bringing people to the table. Sarah, I saw you unmute too.
My internet is so bad. Did you say something, Tamara?
Oh, I was just pointing out, I saw you unmute whenever I raised my hand.
I think we might be on the same page with the way we're thinking, probably because we do a lot of work together. But a comment was made. It's really hard to think outside. And I think if we think about that, and by we, I mean white peers and I, why is it so hard for me to think outside of the system that, for better or worse, fits my needs? Because I'm inconvenienced less by it. And I think that that's part of what we're asking, maybe in white allies. And I mean, this is just one of the hundreds of things that need to be asked of all of us, which is, if it's hard for us to think outside of the existing system, ask ourselves why. And for me, it's because even as a woman, for which medicine falls short severely, I'm getting what I need. I know how to get access to what I need. I know the pathways, whether or not they are efficient or if they're really kind of community created. There's a pathway that I've established because someone did it before me. And I think that it just takes extra muscle, and it takes a heck of a lot more being quiet, which I'm not doing in this moment, and listening, and then following the advice that you've solicited from a community. If you're looking for a particular community's advice on how to fix a system, there's bringing people to the table. But if you've already written out the agenda for the day or for the year and the goals and the mission of this group, and you're saying, here, we want your opinion. Well, again, we've repeated the cycle of creating a system without the people who are closest to the problem being a part of designing the solution. So I think that a lot of things come to mind, but the two things are really, if it's difficult to think outside the system, which I think it is for people who walk through America as white, identifying as a white person, there's a reason for that. And contemplate that, and then find out what it's like for other people who don't look like you to go through the system, who don't sound like you, who have an accent, because there's a difference. And that's just like simple awareness, but you have to use a muscle to go do that. And then the other part is and I think this is what my fellow panelists have said, that when we invite people to the table, I can say that in our work with different programs at the state of Maine level, the agenda is already written. They have invited Maine Access Immigrant Network for a perspective from the immigrant community with good intention. But the agenda for the meeting and the end goal for the project has already been decided. Now whoever we might be working with, would like our perspective. And I think that it's that moment, it's that action that has to flip. If that makes any sense.
Yeah, it does. Thank you so much, Sarah. Thank you so much for your perspective. I think there's a lot of things that stood up with me, especially from the cross-cultural community people who, pardon me, I don't remember your names, but I think if I'm not mistaken, they mentioned the hypocrisy of people trying to act as if they want to solve the issue, but they're the ones that do not include people who are BIPOC at the table. And that really stood up with me, because if someone is trying to help, unless they do not have the ability to put people there who are members of BIPOC, but if they actually trying to help and they have the ability to do so, they should include people in the BIPOC community. And that was a great way to kind of like understand this white savior, or how people may not be perceived as white savior. I also agree that it is hard to think outside the box, especially if someone has been in the box for their whole lives. I mean, if someone was born into, for instance, a racist family, and it's just not easy to get out of that box. And that's something that I really like thought of a lot. And it kind of like give me a way to empathize with people who are racist or people who are ignorant, I would say the least. I just feel, empathy towards them. I also would like to agree with Tamara when she mentioned that racism is our problem as a human race and not just like a Black people problem. I think racism affects everything that we all do in our daily lives, and it's really nice to know that people can recognize that it's just like a human race problem, and we should all solve it instead of just Black people. I'm also curious, with all these things that we just mentioned, what can we do to help people to think outside the box? Perhaps do we need to do any more training or education with professionals about EDI, equality, diversity, and inclusion? What do you people think? Do you think that would be a better approach, or anyone think that there's maybe ways to kind of like help people out there to think outside the box, or just help BIPOC members to be more included into the healthcare?
This is Nicole.
Can I go? I have two that I could throw out.
Sarah, I think you are frozen, or it's just me? Is she?
I don't think she's frozen up, but I think Nicole was first and then Sarah.
Okay.
Thank you.
So from my standpoint, and as a program that works with lots of healthcare facilities and hospital systems and rural hospitals, I think that always continued outreach, education to leadership needs to be a continual, and just because of what we see as a high turnover in staff and leadership, but just always making it to the forefront. So like they've done some equity diversity training one time 2 years ago. Well, things change all the time. So from our standpoint, we really just try to promote and provide any type of resources we have. So that's part of the culture of the hospital. It's not just one special innovation project that they do and then they move on to something else. That is a standing protocol that we try to support, especially within, you know, some of our more rural healthcare hospitals and our health centers. So that's something I would be always wanting to promote and continue to do. Plus, as another point is that as our office, we support our J1 Conrad 30 program. So this is physicians that are here coming to Maine. We get 30 slots. And they are here doing their residency, but they're all from all over the world. So when we want to have a physician or you know, another practitioner that wants to work in rural areas, we want to make sure that the healthcare facility has all the steps in education and resources they need to welcome their family into that community also. So it's a positive experience for everyone.
Thank you, Nicole. I think Sarah was next.
Yeah, somehow she's not on here. I know she said that her internet was spotty. But I don't see, is she here? I don't see her.
She's I can text her.
Maybe she's gonna come back on, but I will say one thing. Nicole, I appreciate what you just said. Oh, here she comes. I appreciate what you said because I do think it's more than just, oh, why can't I get on? I do think it's, I think it is more than training, and it's more than training like once every 2 years. And so I do think if there are organizations out there, and maybe even individuals, it is time for us to take a look at what our mission statements are and what our visions are and what our values are, and take a look at all of that, and really come up with an actual plan. It's going to be a lifelong plan. What we want to do to try to change systems. And so you're right, it can't be this one and done. I mean, we're constantly, I think all of us, you know, are constantly talking about what else can we do? Because it has to be incorporated into our daily lives. It has to be incorporated into our work, and not only incorporated into our work, but as we're incorporating this into our work, there has to be some individual change. So there's kind of two tracks. There's the individual change and then the organizational change. And I think organizations, if we're going down that path of having them create some kind of an equity statement or an equity plan, I think organizations also have to be ready to say, this may not work out for you and I, right? If you have someone who's working for an organization and they're not ready to do this work, it's time to cut ties. And I don't mean to be crass or mean or whatever, but I totally agree. I can't remember, and I know it just happened 5 minutes ago. This is a societal thing, right? This is a public health, racism is a public health thing. And that's why it needs all of us around the table to try to figure out how we're going to do that. And if there's somebody that's sitting around the table or somebody in an organization that's not ready to take on that work or do that work, then again, it's time to unfortunately cut them loose and find somebody who's going to be able to live by the equity statement or the equity plan that you have put in place. So anyway, I will end it there.
Thank you.
Dr. Cooper has her hand up. I wanted to just give a shout out to Dr. Terry Cooper. She is going to be on a panel tomorrow. She is, I think at this point in time, because Javier Botana is not at the Portland Public Schools anymore. But I think Dr. Cooper is the only, correct me if I'm wrong, the only superintendent in the state of color And again, I could be wrong, and so you can certainly correct me if I'm wrong. But we're so grateful to have you here, and we look forward to having you on our panel tomorrow when we talk to the rest of the superintendents in the state. But I will turn it over to you.
Well, thank you so much. Now I feel like I have to really say something profound because I don't know if I had profound statements, but thank you very much. I don't know if I'm the only person of color in the state. I know that I am the first Black female superintendent in the state of Maine to lead a school district. And I'm not certain where we are now as far as other superintendents of color. So I'll have to research that and get back to you. But I just wanted to give kudos to you and what you said about we have to go beyond training. It's not about training. It's not about just developing a plan either. It's about the action steps that you put in place and you carry out and you monitor and note if there are changes. One of the things that we've been doing in this district since I came on board, I had a board that was, just really supportive of equity, diversity, and inclusion. And we created an ad hoc committee during one of the most trying times, 2020, to talk about what we can do to ensure that our students who come from pre-K all the way up through 12th grade, they have this exposure, this experience to people who look differently, who sound differently. Note that I have a different sound. It's not quite as Mainer yet. A different sound, who view things, through different lens, and how you interact and how you can coexist harmoniously, right? Like you appreciate those differences. So we had a 60 member committee who put in this robust plan of these different things that we wanted to do to affect change in our school community. 21 came, we still were grappling with COVID, and we were able to take some small steps. But to be honest with you, we can write a million plans and have a great, laundry list of things we want to do. It is about what you put in place. And one of the things that we did was we put in this robust recruitment strategy or plan to go out and not only look at ethnically, if you're Black, if you're white, you're Latino, you're Asian, you're whatever, but getting people from across the country. So traveling south, traveling, west, and we're recruiting people and bringing them in because now we're thinking about people who have been exposed to different things, right? You have different ideas, different ways of operating, different ways in which you perceive things. And that sparks the conversation because one of the things that I've heard consistently is this is just the way we do things. Well, is it the best way to do things? And you're not going to change the way you do things unless you hear another perspective. So that was important to me. Now, the other piece that's important to me is that we do have some students of color, not many, in our school district. And how do I allow them to see themselves in leadership, beyond me, beyond the directors, beyond the classroom teachers, beyond, the ed techs, how do they see themselves in the school? And it's really hard to get people to come to Maine. The housing shortage is real here. The difference in pricing across the country, from the South and here, there's a big difference in housing prices. So one of the things that we did is went through an agency. It's called Global Educational Concepts or Global Education Concepts. And it wasn't a partnership that was established in Maine. It was something that I had in North Carolina and used it extensively, but it was through a different company, but the same concept. And they work out their J1 visas, everything. We appealed to the Department of Ed, received a letter of no objection. And now every superintendent, every district in the state can work through this company to secure international teachers. And so we are taking on 4 international teachers next year. J1 visas, like I said, are taken care of. We just have to support them once they get here. And that's going to be one way that we bring in some diversity, because I can talk a great great game all day long about how accepting I am of other people and how I can work with other people. It's not until you're actually with other people that you're put to the test, because your ideas are challenged, your interactions become, I don't know. And I think that's going to be important that we do that. So the board is 100% behind this. And we're going to continue every year to bring in more so that we can diversify our teaching staff, and for people, for not only students of color, but for my Caucasian students to see, people of color in leadership roles. And so that's one way that we're doing that.
Thank you so much, Terry. Talking about schools, I'm just wondering, you mentioned that we shouldn't, trainings alone is not enough. So do you believe that maybe education or adding more curriculum into the schools before, students graduate in the healthcare field will be more helpful?
I certainly do. What's in the curriculum is what gets taught. So I think definitely adding, and I think if you look at all aspects, whether it's health field, whether it's this, it's that, the other, the more that you put in it, it becomes a part of. What we have to stop doing is doing things in silos. Diversity isn't like, okay, now we're going to have a diversity course. Diversity should be embedded in everything that we do. Inclusion isn't just a course or a training that we take. It should be embedded in everything that we do, that it becomes seamless, to us. And that's the way you change thinking. That's the way, it just becomes a part of, I can't remember who said it. Someone said something to the effect that it's hard to change because this has been your experience. Well, if we give kids those experiences every day, then that becomes what they know and what they believe and how they operate. Just my thought.
Thank you so much. That was very helpful. I also have another question. What can the community do to engage community members to be excited regarding the healthcare profession? Like, what can we do to make people out there more excited about the healthcare profession, especially BIPOC members of the community? Anyone?
So this is Nicole. I can just share with you, we need really strong mentors to be out there and to be working with our communities. And I think that, really knowing their story and knowing, if they had come through a pipeline program, how they were able to get to where they are now, and really not just in the mentoring, but also just be the champion. And then not just, and it doesn't, and what I always say, like, it doesn't need to be one. You need to have a whole community of mentors. And especially I had a wonderful conversation with a woman from Connecticut that she was interviewing me. Then I actually was interviewing her afterwards and talking to her about diversity and BIPOC communities. And she's a mental health therapist. And so really what engaged her into getting into the field is that while she was in grade school, she had a teacher, and then there was a coach that really guided her into the field that she's into now. And so she really goes back to those positive experiences. And even though when things got challenging for her and she had to take some time off from school, they didn't forget her after she graduated. They kept in touch, and so really kept her moving forward to be able to get where she is now. And it's, like I said, it's a continued growth. and to be to support in the communities 100%.
Thank you, Nicole.
I think it's also important to have, in addition to mentors, to have people who have experience in situations that were negative or unfortunate, but then because of some outcome or some way in that situation, they had someone involved in that experience that turned positive, selling the point that is it's good for the community, right? The impact, because looking at the fact that if they will have a provider from their own community, or I mean from their culture, from their group, how different will be that experience, and kind of encouraging, motivating other people who have going through that experience, and that kind of lead them to the profession, healthcare professional field too.
Thank you so much. That was very good. I'm also really mindful of the time that we only have 9 minutes left. But I'd like to maybe ask this last question to all the people here, the panelists, people who have attended this meeting. Does your agencies have any luck working with healthcare? And if so, what do you do to include BIPOC members? And what benefits does that have on your companies or your agencies?
Okay, if you repeated the question.
Yeah,
Just
sure.
Selfishly, it didn't come on my end.
Yeah, sure, that's fine. I'm just asking if any of the agencies here have any luck working with BIPOC members of the community regarding the healthcare system. Like, do you maybe kind of like work with nurses or doctors or people in the healthcare system? If so, do you have BIPOC members? If you do, then how did that help the company or agencies that you work with? We're just trying to get people excited about having a diverse group and what that does to the agencies. Yeah, sure. I think Kathy was first. And
Kathy was first. And then get out of the way, because we're not a healthcare provider and don't only focus on healthcare. But I just want to say, I think I've seen at Maine Equal Justice the importance we have increased our diversity as an organization, both in terms of staff and also in terms of the leadership teams of directly impacted people that we work with over the last several years. And, it definitely does change both the solutions that you're trying to identify to press forward. We do a lot of advocacy, but also it changes. It forces us to rethink our internal culture and the ways, what we prioritize, what our interactions are. And so I think it's definitely a huge benefit for us. And then I did also just want to name, this is sort of related to something that I think Sarah said earlier, which is we have worked really closely with directly impacted people around healthcare access, particularly around immigrant access to Maine Care over the past several years. And, it was really important to us as part of creating the structure in which we made decisions for that campaign, that it not just be that we wrote a plan and then asked for people to have, is this okay with you? Which is kind of how most advocacy organizations do their work most of the time. And instead, had a leadership team of directly impacted people, had organizational partners, including Maine, who were at the table and trying to have those conversations together all through the process, so that we didn't come in with something baked that we were just kind of trying to hope for sign off on. And I think that too, and we've done similar work around dental access, that I think that all makes it better. I think one of the challenges that we continue to experience is when we try to get like the state, like DHHS, for example, to say, hey, this process really worked. Like all the stakeholder engagement around creating a new adult dental benefit really actually worked and made it better for people who were directly impacted. It made it better for providers, and it made it better for you all. Trying to get them to understand that they could do that through other areas throughout their work is a challenge. And so I think we're just trying to keep helping to press that like this can be a successful model that we can try to implement across more of our work collectively.
Catalina?
I'll
Thanks,
say that
Juliana.
Maine Access Immigrant Network, community health worker organization with a board and staff.
Okay, I'll continue. So I would like to talk particularly about the immigrant community and the experience we have had at our program with them. So it's been very rewarding for us to work with them because we have some people that were nurses or were physicians or were pharmacists in their original countries. And I'll go back to the point that we don't have enough information out there. So I'm an immigrant myself, and I'm a physician. And when I came here, I really didn't know anything about what was the process to get licensed or what are the other options I have if I don't want to follow the path to get licensed in medicine. So it's been really a beautiful experience to work with them. If you are a pharmacist in your original country and you don't know how to get licensed here, but maybe you also need to be working because you have a family and you have to provide for your family, so you cannot go full time to school, then we can offer something like, okay, what if we find a pharmacist technician opportunity for you? You could be like, it's not exactly what you were doing in your country, and we would like to have your license like right away. But what about if we start like, this would be like the first step in that pathway to become a pharmacist again or to become licensed again? What if you were a nurse? I know that you cannot come here and just say, I'm a nurse, and just go into the healthcare system. But we can provide the option to start like CNA or go to training for LPN, and that would be like the first step to continue. So we had really good experiences with nurses and pharmacists, and also with doctors that they didn't go to the medical license, but they are now training as medical assistants. It's not the same, but it's just like one step towards that. Thank you.
Thank you so much. And I wish we had more time so we can, keep asking more questions and get answers for, I think I learned a lot of things today. We only have 2 minutes left, so I think I will just give back these to the cross-cultural community so they can kind of like conclude for us. Thank you very much to everyone who attended this meeting. I'm going to go ahead and put my information in the chat below. Again, I work as a PR Plus navigator, so I kind of like navigate the work system and do other things. That's just one of these things. And if you would like to connect, I will be more than happy to do so. Thank you very much, everyone. And thank you for, it was an honor to be a facilitator. So thank you.
Yeah, thank you for that. I just, I remain in awe of all of you and all of us who are doing this work. This week has just been such an incredible and amazing week for us. And I know it's just going to get better with tomorrow. Like I say, Dr. Cooper will be part of our panelists. We're talking to some of the high schools in the state. And then Friday, we have our health fair right here at the Equality Community Center. And so I just really appreciate the conversation, the honesty and the authenticity that everybody has shared here today. Thank you to our facilitator. Thank you to our panelists. Thank you for everybody that attended. It's just been an amazing and incredible week. And what a way to end Black History Month and then go into Women's History Month. And so again, thank you, thank you, thank you. I look forward to seeing you all tomorrow.
Thank you everyone.
Thank you.